And before you start the timer, I'm going to just step down here and start the speech down here rather than up here so that I can see what I'm pointing to. Now, obviously, there's a blank screen. However, this speech that I'm delivering to all of you is a technical speech. So you put your dentist hats on, pretend you're dentists sitting there, and there's some periodontists in the room, that's gum doctors, and there's some root canal doctors and general dentists. Well, I'm a prosthodontist, and there's periodontists, and it's the periodontists that are running this, and they've asked me to give this speech regarding a case treatment that I did, and there'll be a speaker that went on just before me that did another case of a similar type. So, this is a case review, and it's a case that I did treatment with Dr. Reiser and Dr. Wise, and it's our periodontal prosthesis study club, which I am grateful for because I'd like to acknowledge the previous speaker, Dr. Sid Whiting, who's presented before, and the study club itself gives us the venue for having a communication about how we're going to go ahead and do these cases. Now, I'm going to ask you, this is a 15-minute speech, and it's concise, but I'm going to ask you to beg off on questions because it's a study club, and study clubs usually supposed, but I'm going to ask you not to, because it's a 45-minute time that I have to speak, but I'm going to make my speech 15 minutes, and there's decision points and discussion points that will open it up when I'm done. So, this is a history of a patient who had medical history, and he had non-surgical dental therapy, and he was referred to the periodontist in 1984, and he had cleanings and root planings, and his teeth cleaned, but he continued to have periodontal infections, particularly on two teeth, his lower left second molar, tooth number 18, and tooth number 12, which is upper left bicuspid. Now I'm bouncing back and forth between using dental jargon. Yes?
Have you actually started your speech yet?
No.
Or are you just leading up to it? I couldn't quite tell.
Speech starts the minute you make a motion or a sound.
What's that?
The timer starts the minute you make a motion or
That's
a sound.
right.
Okay.
So you're on Candy Camp.
So you're on the clock.
All right, I'm on the clock. Yeah, put me on the clock. All right,
Okay.
ready, go.
Sorry. So you don't know.
I mean, you really, okay. So, this patient from 1984 to 2002, he was having his teeth cleaned, and he kept getting these sore two areas of his teeth. And meanwhile, his gums, his periodonture, was going downhill, but he was just getting his teeth cleaned with the periodontist office. Well, finally, in 2006, tooth number 18, the lower left second molar, you can see it. You can see it was extracted. And that prompted this patient to go ahead and say, well, gee, I better take care of my other tissue, the gums on my other teeth. So, I just plugged this in. So, when he had all his gums in periodontal surgery to eliminate the infection of his other gums, which were moderate, and he requested, at that time, he was a very highly health awareness and a highly accomplished individual, and he requested that, is there something else you can do besides work on my gums? You know, and so he said, well, go see Dr. Dornbush. And because he defined that he wanted his tooth color and his crowding and the position of his teeth. And you notice I only had pictures of his teeth because he wanted some discretionary confidentiality. I have one picture of him, but I didn't want to flash it because he lives in the community and all that. So anyway, he, through a process of little yeses over time, he had a flare-up of tooth number 12, which prompted him to say, I'm going to do something now. Because tooth number 12, remember, is the upper left second bicuspid, and the upper left second bicuspid is right here, and that's getting near the front. So he decided that with all this crowding, and this now his front tooth is missing, that he was going to really do something restorative. So he went to Dr. Wise, and Dr. Wise said he could straighten his teeth with adult orthodontics. I mean, he's now in his late 50s. So he extracted tooth number 24, but it's right there. And then they moved his teeth orthodontically and positioned all the teeth orthodontically. Then made sure that the bite, took the braces off, adjusted the bite, and he said, now go see Dr. Dornbush. And when he came to my office, the conventional wisdom, and one of the debate points that'll be with the dentist is, why don't you just whiten his teeth and fill the little space with bonding? Well, he said, bonding, and the father of tooth whitening is Dr. Hayward. He said, but my teeth, they're never going to get that white. So, through, what's that? So this man was very efficient. He never even called us on the phone. Everything was with his little BlackBerry, and he would punch in the BlackBerry, and he would say he'd like to have an appointment, he'd like a consultation. So we emailed him all these case presentations and descriptions of what things that we could do. So then it became and we came up with a proposal to restore all his teeth, take out his oval crowns and put in restorations on his 6 front teeth, new restorations, 6 front teeth on the bottom and 6 on the top. And of course I put these decision points, again this is something we'll discuss at the end, because some people will say, well, why didn't you just do the bonding and the whitening? And we did the lower first. There's a Dr. Dawson, who's one of our mentors, said do the lower arch first, because if you do the lower arch first, it'll dictate the way the teeth, really the plane of the teeth, and he had lip asymmetry, which you can see. And with the lip asymmetry, if you do the upper teeth, let's see if I can do this. If you do the upper teeth first, and form these surfaces, then when you go to make the lower teeth, you got to make the lower teeth match the backs of these teeth that nobody can see. So you have to do the lower teeth first. And then we did all ceramic restorations on the front teeth, and ceramic based on the substructure on the back teeth. And then we went to the upper teeth. And the upper teeth, there were many things to consider about doing in the upper teeth. And this is a list here. We won't go through it because you're not dentists. But there's a long list. And some of the things we did, but we make a temporary, and from that, that's our basic, you make a temporary restoration. And this is temporary, and then you take pictures of it, and you put it in email and PowerPoint, and you send it off to the laboratory. And this is a list here. This is like all the slides of the laboratory prescription. It describes the length of the centrals, how long the teeth are, what the color of the teeth are underneath, because we had to file them down and all that kind of. And we had to pick a color. And another mentor, Dr. Kramer, said always avoid your subgingival margins. Don't put the margins. You can see this is right under the margins. Shove it under the gums, because. But if you do all ceramic, you can keep it higher than the gums, and therefore it won't show the dark line of the metal, because there's no metal in all ceramics. So we had to work out the occlusion